Welcome to Diabetes Basics with Verb Health. My name is Melissa Heyman. I'm a registered dietitian and certified diabetes educator, and we'll be walking you through this presentation today. We'll be covering the following: what is diabetes, types of diabetes, self-monitoring blood sugars, which will include blood sugar goals, hemoglobin A1C, hyperglycemia or high blood sugar, as well as hypoglycemia or low blood sugar. We'll also cover ways to manage blood sugars, including medications, diet, specifically carbohydrate counting, physical activity, and stress management. So what is diabetes? Diabetes is a disease that occurs when blood glucose or blood sugar is too high. Blood glucose is your main source of energy and comes from the food you eat. Your body turns the food you eat into glucose, which stimulates the pancreas to produce insulin. Insulin is the key that opens up cell doors for glucose to be stored as energy. There are different types of diabetes. Type 1 diabetes was previously referred to as juvenile diabetes. However, it is an autoimmune disease that can occur at any age. About 5% of those with diabetes have type 1. Those with type 1 do not produce any insulin, so require insulin to keep blood sugar levels in control. Type 2 diabetes is the most common, occurring in about 90 to 95% of those with diabetes. This can occur at any age, even children. It often happens because the body does not use insulin properly, referred to as insulin resistance. Being overweight can contribute to this, which is the reason we're seeing more children with type 2 diabetes. And then lastly, gestational diabetes occurs only during pregnancy in about 2 to 10% of women. Our slides today are mostly going to be focused on type 2 diabetes. Blood sugar monitoring is the main tool to monitor diabetes control. This check tells you your blood glucose level at any one time. How often you need to test will depend on a number of factors, including blood sugar levels, medication, your schedule, and your ability to afford supplies. You can discuss how often you should test with your healthcare team. Keeping a log can not only clue you into factors impacting blood sugars like meals and stress, but also provides your healthcare team with a clear picture of your body's response to your diabetes care plan. Keeping blood sugar levels in a healthy range is important. If they get too low, you can lose the ability to think and function normally. You should talk to your healthcare team about your specific goals, as the American Diabetes Association and the American Association of Clinical Endocrinologists have different goals, with the AACE recommending tighter blood sugar control. For fasting blood sugars, 80 to 130 or less than 110 are in range. If testing 2 hours after meals, the ADA recommends less than 180, while the AACE recommends less than 140. In addition to reviewing your blood sugar record, your physician may also order a hemoglobin A1C test. Excess sugar in the blood attaches itself to hemoglobin cells, also found in the bloodstream. The more sugar on these cells, the higher the A1C. This test provides an average blood glucose level over the past 2 to 3 months. And this table provides an estimate of average blood sugars corresponding to a particular A1C. For example, if your hemoglobin A1C is around 8%, it tells your physician that your blood sugars have been running on average about 183. Hyperglycemia is the clinical term for high blood sugars or high glucose. Symptoms include frequent urination, increased thirst, dry mouth, and fatigue. It may be caused by a variety of reasons, including certain medications, inadequate diabetes medication, eating more than planned, exercising less than planned, stress from an illness, emotional stress, inadequate sleep, and hormones. If blood sugars remain high for long periods of time, months and years, it can cause the complications listed, including neuropathy, which is damage impacting the nerves of mostly the hands and feet, skin and eye issues, heart disease, and stroke, as well as kidney disease. On the opposite end of the spectrum, we have hypoglycemia or low blood sugar. This occurs when blood glucose levels fall below 70. People may experience hypoglycemia differently, but many of the symptoms are listed here. Often people feel shaky, lightheaded, or even hungry. If you have these symptoms, you should first check your blood sugars to determine if it is truly hypoglycemia. If your blood sugar is less than 70, you'll want to employ the 15-15 rule or the rule of 15, which entails first consuming 15 grams of carbohydrate, which could be 4 ounces of juice or soda, 1 tablespoon of honey, 1 cup of milk, or even 3 glucose tablets. Then you're going to recheck blood sugars 15 minutes after consuming these carbohydrates. If your blood sugar is less than 70, then you'll repeat steps 3 and 4. Managing blood sugars isn't simple. It involves taking medications as prescribed, eating a healthy diet, being physically active, and managing stress. Depending on your blood sugar levels, your physician may prescribe medication. There are many types of diabetes medication, and they work differently. Some work to make the cells more receptive to insulin. Others stimulate the pancreas to produce more insulin. Some impact hormones related to digestion, and others prevent the kidneys from reabsorbing sugar into the blood. You may not need any medications, or you may require multiple oral medications, and you may even need insulin, which is most often taken by injection but does come in an inhaled form as well. You should consult your doctor or pharmacist if you believe you are experiencing negative side effects related to your medication. Eating a healthy diet is an important part of managing blood glucose control. Diabetes shouldn't stop you from eating a wide variety of foods, including your favorites. Those with diabetes have the same nutritional needs as anyone else. A healthy meal plan for all adults includes mostly unprocessed whole foods that are high in fiber, low in added sugars, low in saturated fats, and contain no trans fats. It's also important to understand carbohydrates when managing blood sugars. Your healthcare team may recommend you follow a very low carbohydrate diet, the glycemic index, or use traditional carbohydrate counting or carb counting to manage blood sugars. Whatever is recommended, understanding carbohydrates is important as they have a direct impact on blood sugars. The benefit of carb counting is that it provides more choices and flexibility when planning meals. It involves counting the number of carbohydrate grams in meals and snacks. So what are carbohydrates? Foods that contain carbohydrates or carbs include grains like rice, oatmeal, and barley, grain-based foods like breads, cereals, pasta, and crackers, starchy vegetables like potatoes, peas, and corn, fruits and juice, milk and yogurt, beans, lentils, and soy products like veggie burgers, sweets and snack food like sodas, juice drinks, cakes, cookies, candy, and chips. Now, non-starchy vegetables like lettuce, cucumbers, broccoli, cauliflower, they have very little carbohydrate and thus minimal impact on your blood sugars. So you're probably asking yourself, how many carbohydrates do I need? The amount of carbohydrates you need will depend on a number of factors like gender. Males generally need more. Weight, those of higher weight may need more carbohydrates. And activity level. You'll need more to fuel higher activity levels. The table here is a good place to start, with women requiring about 45 grams of carbohydrate at meals and about 15 grams at snacks, and men needing about 60 grams at meals and 15 to 30 grams at snacks. It's important to space carbs out throughout the day rather than saving them all for one meal. This helps to keep blood sugars more level throughout the day. The nutrition facts label will be helpful in determining the amount of carbs you eat at meals and snacks. You'll first want to look at the serving size. This particular item's serving size is 2/3 of a cup. The 55 grams there in parentheses is the weight in grams of that 2/3 of a cup. There are 37 grams of total carbohydrate in one serving, or that 2/3 cup. If you ate 2 servings, or 1 1/3 cup, you'd consume 74 grams of total carbs. 4 of 37 grams come from fiber. Fiber is a type of carbohydrate that doesn't really impact blood sugars, so it could essentially be subtracted from the total carbs. You could count this product as 33 total carbs, which is 37 minus 4. 12 grams come from sugars, so 12 out of 37 grams come from sugars. These include both naturally occurring sugars from things like fruit or milk and added sugars from sucrose or other forms of sugar. The new labels will further break down these sugars into added sugars. So 10 out of 12 grams are coming from added sugars. Carbohydrates are one of three macronutrients, with protein and fat being the other two. Proteins and fats don't have a high impact on blood sugars, but can impact weight and overall health if eaten in excess or are of poor quality. Not every food has a label. It may not always be available, as is the case for fresh produce, kitchens, or even restaurants. While most restaurants are required to display calorie information on their menus, the carbohydrate amounts are not generally displayed. More detailed information may be found on the restaurant's website. You can also utilize a website or a mobile application like MyFitnessPal to enter meals and track carbohydrate intake. An online recipe calculator is very helpful in determining carbohydrate amounts in your favorite recipes. And you can use Verve's Carbohydrate Guide as an adjunct to this presentation, and it can be used to estimate carbohydrate amounts in common foods. So, wondering if alcohol is off limits with diabetes? Research has shown that there can be some health benefits, such as reducing risk for heart disease. However, it is not without risks. Drinking alcohol can cause a drop in blood glucose because alcohol blocks the production of glucose in the liver. The liver contains emergency stores of glucose to raise your blood sugar if it drops too low. Once the liver's stores of glucose are used up, a person who has drank a lot of alcohol can't make more right away, and that can lead to dangerously low blood glucose. You should consult with your doctor or pharmacist to determine if alcohol is okay with your medications. And people with diabetes need to use the same guidelines as those without diabetes if they choose to drink. For women, that's no more than 1 drink per day. For men, no more than 2 drinks per day. While regular physical activity is important for everyone, it is even more impactful for those with diabetes. Physical activity allows your cells to become more sensitive to insulin, thus working to decrease blood sugars. Regular physical activity has many benefits, including lowering blood pressure and cholesterol, reducing the risk for heart disease and stroke, strengthening your heart and improving circulation, reducing the symptoms of depression and improving quality of life, increasing your energy for daily activities, burns calories to help you lose or maintain weight, improving sleep quality, relieving stress, strengthening muscles and bones, keeping joints flexible, and improving balance to prevent falls. Any movement is better than none and still provides health benefits. For more substantial health benefits, aim to do at least 150 minutes per week of moderate intensity exercise or 75 minutes per week of vigorous intensity aerobic exercise, or an equivalent combination of the two. Examples of moderate activity include brisk walking, ballroom dancing, or water aerobics. Examples of vigorous activity include running, swimming laps, or cycling. For additional health benefits, you should aim to do strength training activities that involve major muscle groups on 2 or more days per week. Any amount of physical activity, even 2 minutes, can add up to huge benefits for your immediate and long-term health, and this is according to the new edition of the U.S. Physical Activity Guidelines for Americans. So what about stress? Diabetes management is a constant process and can be complicated by stress. Sources of stress can be physical, like injury or illness, or stress can be mental or emotional, like problems in relationships, our jobs, health, or with finances. While we all have stress in our lives, excessive stress works against diabetes management by increasing blood glucose levels. It can impair sound thinking and decision making, and this can lead to poor eating habits and other poor health decisions like excessive alcohol consumption, too little or too much sleep, and inadequate exercise. Everyone handles stress differently, and one method of dealing with stress may not work for another person. Here are a few tips to manage stress. Getting regular physical activity, and getting an adequate quantity, 7 to 9 hours, and quality of sleep. Practice deep breathing or meditation. Take time to do something you enjoy daily. Lean on family and friends. You could even join a diabetes support group, and eliminate unnecessary activities. Stress management is an important part of improving your overall health and managing diabetes. If stress management is a struggle for you, consider talking to your doctor or a therapist. Diabetes is a complicated condition and it is normal for it to feel overwhelming at times. However, diabetes can be controlled through lifestyle behaviors such as physical activity, eating a diet to promote a healthy weight, taking medications as prescribed, blood sugar monitoring, and managing stress. These behaviors can help prevent or delay complications and allow you to live a long and healthful life. This includes our presentation for today. Please be sure to contact your healthcare team if you do have any additional questions. Thank you for joining us.